Now we're about to talk about some of my most favorite things. And when I look at Shelly Linehan from Full Circle, I see that you look fit, you look amazing, and your skin is nice. It must have something to do with some of these things you've got lined out here today.
Well, you know what? I could probably do better, as could most of us, probably. Health is a journey. It's not a destination. So we can always find things to improve. And I realized Tyler and I have been doing the show for a couple of years, and we've never really talked about what naturopathic medicine actually is.
I think that down the line, we've sort of lost that, haven't we?
Yes.
And when we look at it on a big scale, it's so massive. But I like what you just said. It's a journey, and it's a step at a time. So
That's right.
If I were to embark on this journey now, how would I start?
Well, this is a really good time to talk about this because Naturopathic Medicine Week is coming up in May. It's the week of May 11th. So yes, we use that opportunity to sort of get our message out in terms of who naturopaths are and what we do, and I refer to naturopathic medicine as complementary medicine.
Okay.
So a lot of people think, you know, they have this misconception that they have to choose one or the other, and that's not the case. It's not an alternative, it's complementary, and you can use both. So naturopaths are regulated in the province of Ontario. They're regulated by the same branch of the government that regulates your medical doctor. Soon, we're going to be regulated under RHPA.
This is good news.
Great news. We're going through a lot of changes in the profession. Getting general prescribing rights and seeing some changes to our scope of practice. So this is a big year for naturopaths. So Naturopathic Medicine Week at Full Circle is really going to be celebrated. So our main modality, sort of what sets us aside from your medical doctor, because we are considered primary health care, what sets us aside is we don't use drugs and we don't use surgery. That does not mean we're against drugs and surgery. It's just not what we do.
So we're not going to do surgery here today?
Unfortunately, no.
That's okay.
Yes. Yeah. So our main modalities tend to be more natural. They tend to carry with them less risks of side effects and interactions.
Right.
That's not to say they're without side effects and interactions.
Of course. You can get into trouble sometimes.
That's right. So we have a handful of modalities. We have quite a few modalities that are part of the general scope of practice. So finding a naturopath that works well with you is really important because you want to find a naturopath that focuses on the modalities that you value. So for example, in my practice, I largely focus on diet and lifestyle coaching for my long-term goals, and then my short-term goals, we tend to use nutritional supplements and herbal therapy. Okay. So our main modalities, all naturopaths are trained with the general scope of practice that's very similar to a GP. But instead of using drugs and surgery, we use things like diet and lifestyle. Okay. So, you know, looking at things that you can use to improve your nutritional profile and improve sort of your general intake. So things like meal replacement shakes or protein shakes, greens, powders, they're great functional foods. I don't even really consider them supplements because they just add variety and nutritional variation to your diet. If people they have a hard time making those lifestyle changes, then of course we can move to nutritional supplements. So you can look for micronutrients in supplements, vitamins and minerals. You can also look to supplements for things like herbs. So herbal medicine or botanical medicine is also a mainstay of naturopathic medicine. And then we can go to more of the physical modalities such as acupuncture and Chinese medicine, which is the combination of both acupuncture and Eastern herbs.
This is something I do. I love acupuncture.
This is wonderful. It's a really nice modality to use for, it's a system of medicine. You can use it for anything, but lots of people access it for chronic complaints.
Right.
Right? Chronic pain, chronic stress, that kind of thing. So that's a wonderful modality.
Right.
And then we have homeopathy, and we have some physical modalities like massage therapy and spinal manipulations and that kind of thing. But you will find that most naturopaths will focus on a couple of modalities.
Do you see a lot of parents that come in that want to get their kids on this stuff really early?
Yeah, the bulk of my practice is actually pediatric and prenatal.
Okay.
I have a general family practice, but that is sort of the bulk of my practice. And I find it really encouraging because parents will do anything for their kids.
Of course.
Compliance is tougher with adults. We're very busy, we're stressed out, but for your kids, you'll do it. And they do phenomenally well.
So what things would you want to get your kid involved in? Like,
you know what, at our house, I really encourage parents to not, I think we should eat our nutrition, not necessarily supplement it.
I agree.
Yes. Yeah. So we try to instill in our kids, and I try to encourage parents with their kids that are patients, we should be eating well. We shouldn't be relying on pills to fortify our diet. So trying to incorporate things like functional foods, smoothies and oils and trying to get it through the diet. But kids can be picky.
They can be.
And you don't want them to go without.
Right.
So where you can't get certain things in, doing things like diet analysis is very helpful because you can see what your kids are lacking. And actually, during Naturopathic Medicine Awareness Week,
yes.
We are offering a whole bunch of specials. Tyler, our nutritionist, is offering free diet analysis, which fits into that well. So we sort of look at your intake over a few days, and we get an idea of what perhaps you might be deficient in, and you get numbers here, and what might be worth supplementing, what you can focus on in your diet. He's also offering the generalized meal plan that he does with the 2 consultations for free. Our massage therapist has a couple of discounted rates, package deals, discounts off of initials, as does our acupuncturist, offering discounted initials. And our social worker is going to be doing a stress management lecture, meditation courses, and I'm going to be doing a couple of free seminars also.
You do everything.
We have a really
That's
great
amazing.
team. It's really exciting. I love going to work in the morning.
And I'm guessing you've probably changed a lot of lives along the way. Am I right when I say that?
I like to think so.
Yeah.
One step at a
Excellent.
time.